Many people have questions regarding wearing masks. The mask is often used to limit your ability to spread disease by spreading droplets from your nose or mouth during a cough or sneeze that contain virus. These are known as surgical masks. These masks do not protect the user against getting infection. You may have already seen people on television in foreign countries wearing these masks. In the initial outbreak of coronavirus, the Centers for Disease Control and the United States Surgeon General felt that wearing masks such as this would be wrong, as it would cause a person to touch their face more often than they otherwise might. Other nations have felt quite strongly that measures such as wearing a mask out in public would help decrease the spread of virus. The Centers for Disease Control is considering asking all Americans to wear these masks anytime they are outside or in public. You may see guidelines on this coming from the President's task force in the near future. There is significant concern that should people adopt the use of wearing masks, they will not be adherent to the social distancing requirements that are essential at this time, or that this requirement may deplete masks for medical treatment facilities that are already in short supply. Currently, I do not recommend that you adopt this practice of wearing masks until the President's task force issues a guideline for this. It is important that you distinguish these masks from this other mask that I have here now, which is called the N95 mask. The N95 mask pictured here can be distinguished by its double elastic straps. You see two elastic straps. And the mask is also molded to the face. This mask should only be used by healthcare professionals in the medical care situation to protect them from infection. This mask requires special fit testing, instructions for wear, and is part of a system of other personal protective equipment required by our healthcare professionals. This mask is in critical short supply in the nation. I will now demonstrate the other types of masks that a person could consider wearing. These masks are known as surgical masks. They are made of paper or fabric. A fabric mask is also an option, and these are manufactured by various clothing manufacturers. One typical example of a paper mask is what I have here. It's made of paper. It has a strip that will bend and conform to your nose. It's applied to the face like this. Two elastic straps go over the ears, and the mask is then tucked down to cover the face and the nostrils completely. As you can see, this paper mask fits quite well and serves the purpose of preventing me from making an aerosol of virus products in saliva or mucus should I cough or should I sneeze. The mask can get wet and it should be discarded at that time. The mask is not reusable and oftentimes can cause a problem for people who wear glasses. Remove the glasses prior to applying your mask. This is another example of a surgical mask. This is a little bit more complicated. It requires the user to bend the flexible piece to place on the nose, to place strings behind their head, and then through a course of some dexterity, tie the strings behind their head in a knot that can be easily removed, and then tuck down and tie the second string. As you can see, this mask also serves quite well to cover the face and nose. If you tied the mask correctly, you can remove it pretty simply without a scissors. If you tied the mask incorrectly, it's going to be some struggle to take it off. Another mask that you might see we call the catcher's mitt mask. It's a paper mask with an elastic string, somewhat easier to apply. Take your glasses off, place the mask over your head. The strap should go above the ears, pinch down over the nose to close it, and put your glasses back on. This mask also works well to cover the nose and the mouth and is quite comfortable to wear. Unlike the N95 mask, there is a single elastic strap and it doesn't cause much pressure on the face. This mask does not need to be fit tested, is paper, and should be discarded if soiled or wet. That concludes my demonstration of the various types of masks. Once again, I would recommend that you not adopt this mask wear until the President's task force issues guidance along those lines.